Hi, I'm Katie Ramsey with Inner Pathway Hypnosis.
I'm Kimball Ralphs with City of Roses Hypnosis. Thanks for tuning in.
Yeah. We just we're glad that you want to learn a little bit more about hypnosis, what it is, how it works, and answer a few of your questions.
First, I'd like to explain what hypnosis is not, because in this country there's many common myths about it that have come from misinformation, the results of people only being exposed to it from Vegas stage shows or books or movies. And that's not really what we do at all. We're clinical hypnotherapists. And we work one-on-one with a client in the privacy of an office in a therapeutic session.
That's right, Kim. And the fact is that you and I both go into a state of light trance or a light hypnotic state many times during the day. And that can happen when you're driving and you're focusing on the yellow line in the road, or you're daydreaming or fantasizing or watching television.
Staring into a campfire.
Exactly. Very good. Yeah, really good point. I mean, it's a very normal, natural state of mind.
And it's beneficial in a therapeutic setting because we hold a lot of beliefs and feelings about ourselves and what we're capable of and incapable of. And we store these in our powerful subconscious minds, and we repeat constantly through negative self-talk this programming which stands in our way when we want to make a positive change.
Exactly. And when we, as hypnotherapists, work with a client, we help determine what their goals are. We listen to them very carefully. And when they're in that relaxed state, we work to help shift their process of how they view their feelings, their attitudes and beliefs. And through working with the subconscious mind, we're able to alter their behaviors. Those behaviors get altered at that level because the subconscious is very receptive. The subconscious exists in the right lobe of the brain where your creativity and your emotions are stored.
Yes, every salesman knows that if you want to get a yes from a client, from a customer, you have to engage their emotions, because it's the emotions, that emotional part of their subconscious, which will really make the decision. We'd like to think as logical beings that all of our decisions are made in our conscious mind with logic, but the truth of the matter is all decisions pretty much are emotional decisions. And after we've decided how we feel about something, then we start to analyze and find logical reasons to support that decision.
Yep, that's really right. Exactly. And television advertising is very effective because people are in a light trance state while they're watching TV, and that makes them more receptive to those ads. And so one of the things we just want to address briefly is that there's concern that people feel that through hypnosis they can be manipulated into doing something they don't want to do. However, the truth is that all hypnosis is self-hypnosis. You yourself are giving full permission to allow yourself to be in that relaxed state, just as you give yourself permission to fall asleep.
As a client, you're never in our control. You're always in complete control of what you're thinking and what you're experiencing. And your self-protection system, which lives in your powerful subconscious, is there looking out for you. And so you're really not at any time going to reveal secrets or say something you don't want to say or agree to do anything that your moral code would prevent.
That's right. And Kim, we adhere to a code of ethics that we have a lot of respect for. We're both members of the NGH, National Guild of Hypnotists. It's the largest organization of hypnotists in the world. We have about 10,000 members in our organization. And the fact of the matter is we are very diligent with all of our clients in respecting their needs and their wishes. And if we have a client that feels that their need for medical attention through an MD or through a psychologist or psychiatrist, for example, is necessary, we'll always refer them to those specialists because we understand our practice and our code of ethics.
And the limitations of our training, and the oath we take is as much like the Hippocratic Oath, whereas first do no harm. So we're looking out for our clients' benefits and helping them make the positive changes that they have in mind.
Well, I think that's it for today, Kim. I think we've really covered some really good ground, and the next time we'll talk more in depth about the areas that we do address through hypnosis and hypnotherapy. So thanks again for tuning in. We'll see you soon.
You're not going to mention the part where I do bark like a dog then.
No, that'll be in the next session.
Tune in for the barking next time, folks.
That's right. Thanks.